Welcome to Condom Distribution as a Structural Intervention, Midwest Virtual Institute, brought to you by AIDS United as a part of the CVA Provider Network, supported by Cooperative Agreement number PS 19-1904 from the Centers for Disease Control and Prevention.
By the end of our session today, we're going to have talked about the 3 C's, and that is communication, coordination, and collaboration. As you're all going to see, we do love some of the alliteration and the little acronyms that we have there, and today it's going to be the 3 C's. We've already talked about the 3 A's, and later we'll talk about the 4 P's. But we're also going to look at what might promote or hinder partnerships. We are going to identify individually some of the ways in which we can improve in general as it relates to condom distribution, and then more specifically, what we can do at our own organizations to do so. And then we'll take some time to address ways that we can strengthen the 3 C's, especially during COVID-19. I'll just kind of kick us off by saying we already know that this is even more relevant than before when conducting HIV prevention work, just because of the ways that we have to talk about sex and condoms and different things like that during the COVID-19 pandemic. Even thinking about this institute, we would usually be gathered together in some hall, in some room, gathered around tables, getting into the real nitty-gritty of partnerships and collaborations. And unfortunately, that's just not possible in the world that we're living in today. But we are going to still sit down and talk about our adaptations and ways that we have created best practices for engagement within our partnerships. So we're going to dive on in. We're going to talk about the 3 C's, and as I just mentioned, those are communication, coordination, and collaboration. We've already talked about those 3 A's, accessibility, availability, and acceptability, and now we're going to talk about these 3. They're really important to us to develop our partnerships and be able to facilitate our ability to actually address those 3 A's in the way that is best for our communities when it comes to condom distribution. So we'll talk about some definitions, some concepts, and then we're going to give some examples and talk about your own partnerships. So the first C that we have that we're going to talk about now is communication. In the process of communication, we have a sender. You can actually pop up the little diagram here on the map. Thank you. Sender is our little mouse there on the left who conveys a message, and our receiver is the one on the right who receives it. When communicating, we have to consider what is called the arc of distortion and how that's going to impact the way in which our message is being delivered. I always think of the arc of distortion like a really bad game of telephone. So like that game you used to play when you were a kid, when you would whisper a message to someone and they'd pass it down a line, and by the time it got to the very end, it was an entirely different message, and we all had a good laugh about that. Unfortunately, when we're doing this work, that's not what we want. We want to keep that arc as small as possible. We want the message to be whatever it is that we initially intended it to be. A message, however, can be altered by a lot of different factors, and I would love if people could just plop in the chat what some of those things are. What can change the ways that our messages are received? What can distort our messages? I'll give you all a second to plop those in. And not everybody at once. There we go. Tone, language barriers. Yes, those are both great. I'm seeing noise, seeing language again. What's the big one that's happening right now because of COVID? There we go. Email versus call, face-to-face, body language, technology, eye contact. Thank you. A few others that come to mind are even just identity-based things. So our age, our cultures, who we are, our skill levels, our religion, our abilities. This is great to listen and respond and not understand. Jargon. Absolutely, all of these are incredible examples. And so all of this is to say that when we're communicating with our colleagues or with agencies that are in the community, we have to think about the ways that our messages are being delivered and if they are having the right impact. Intent is not enough when we're collaborating. We have to be really proactive about how we convey messages and think about some of these things in advance. Like a really easy example that I always think about is if I said to Marilyn, For instance, after this call, if I said, thank you so much for all of your help, it was really wonderful, we couldn't have done it without you. That says something incredibly different than if I lean back in my chair and I fold my arms and I say, oh, Marilyn, thanks for all your help today. It says something completely different. And so we want to think about how that works. It's not always going to be that distinct. It's not always going to be so obvious, but we do want to consider that as we communicate with others. So up on your screen now, you're going to see three different modes or elements of communication. We have body language, tone, and verbal. And research has shown that each of these components carries a different kind of weight in the ways in which we communicate and collaborate in interpersonal interactions. Can anyone give one single guess as to which one of these might have the most weight? Go ahead and just plop that in the chat. Michelle says tone. R. Strickland said body language. Body language, tone, seeing a few back and forth between those two. Awesome, awesome, awesome. As some of you have guessed, the answer here is body language. So what we have found is, like in a conversation, research has essentially shown that these are the different weights that these different components take when we're communicating with one another. 55% of the way that we communicate is through our body language. And the arc of distortion is created by the different ways we use our body language and our tone. The actual words that we're saying ends up only being about 7% of the message that we're communicating, and the rest is conveyed through our bodies and the way in which we're saying something. A speaker is going to be most believable and will do the best job of communicating when aligning all of these different interactions, and feelings and facts become more believable when all of these different components are used. We have to think so much now in COVID times about what this means, because we can't, you can look at me right now and you can see some of my bodily expressions and how I'm using body language, but I can't see the same in return. And we have to think about that when we have calls with videos off, when we're sending emails that maybe we would be having in-person conversations for. It's going to change the ways that we navigate collaboration in a digital world. So we'll go on next to coordination, which will follow right after communication. Coordination is incredibly important when you're providing lots of different services to a community, which I know many people in this room are definitely doing. It's especially important if there are multiple agencies in your area that are providing similar services. And so, for instance, an example that I was thinking of is, I know that Vivint Health provides like an online free mailing condom system to people who are living in Wisconsin. So participants are able to essentially just go online, select up to, I want to say, 25 condoms and lube, and they come in like a huge spread of options, and they can be sent to them for free. And so for health departments and community-based organizations that are working in Wisconsin, it might not make sense to create another online portal for ordering. Yes, we know that that's a great way of reaching community right now. We know that during COVID, that is a great intervention, but we don't want just one organization or multiple organizations using the same resources to create just one opportunity for people. Rather, we know that things are available through that medium, and so organizations might consider instead partnering with that organization to build awareness of the resource, maybe doing some social marketing that they are not able to do, or just considering other means of distribution that meet the unmet needs from that particular program. So if we're thinking about a mailing program, maybe thinking about interventions that are going to reach people who are experiencing homelessness and don't have access to things being mailed to their house. Another population we could think about is students who maybe don't want, who are living with their parents and don't want mailed condoms showing up at their home, and that causing all kinds of questions. So coordination is really about making sure that we're providing, we're not providing one of the same effort all across the board. We can also think about coordination when we think about adapting some of our relationships that we already have. So thinking about coordination, so many people yesterday mentioned that their relationships with some of their distribution sites, like bars, like restaurants, have completely changed. Because no longer can we do the piece where we just put out a bowl of condoms on a bar and people who pop on in can use them. And so coordination is also about saying to those partners that we already have, hey, I know you have 200 condoms in a closet that we gave you and we need to do something with them. Can we work with you to get you to partner with Uber Eats and have them sent out to people? Can we have you do a drive-through like Marilyn was talking about earlier? Can we create safer sex kits with other things that maybe you're selling to the community or giving out to the community so that we can coordinate and make sure that those things get out? We also want to think about in coordination some other options for partnerships that we're going to dig into a little later when it comes to non-traditional partners. The very last C we're going to talk about is collaboration. So as I'm sure anybody in this room can guess, what happens when multiple businesses or organizations are working against each other is that this goal you see up here goes nowhere. When we're all pulling in opposite directions, who gains, who suffers? Ultimately, there is no one to gain. We're all just pulling against the same thing and moving in opposite directions. We're not getting anywhere with the work that we're doing. A great example that came to mind, and we've talked a little bit about through condom distribution, is the New York City program for condom distribution. There was a day many, many years ago when they were first really digging into their condom distribution efforts, where every single person who was doing condom distribution in the New York City region was going to the piers. A lot of community members, a lot of at-risk populations would gather there, and there would be like multiple trucks, multiple tents set up, lots of different opportunities for people to get condoms, but they're all just centralized in this one place. And so collaboration is ensuring that you're working with those partners and reaching out to other communities, seeing where you can diversify your portfolios. COVID-19 has really made us rely on these relationships to collaborate to meet the needs of our community, because we have businesses that are shuttering all over the place, and organizations have still had to find ways to provide services to those who are underserved. And we've had to think of really new and interesting and innovative ways to do that. Yesterday, I know Heather mentioned partnering with food pantries to distribute safer sex kits. Other participants mentioned the possibility of testing sites or vaccination sites as partners. I heard a few weeks ago people doing the food delivery services, the food truck style distribution, door-to-door mailing, so many other things just to make sure that condoms are getting in the hands of those who need them. And so with that, collaboration is what you just saw up on the screen, which is the act of multiple entities working in unison to accomplish a unified goal. In a new normal, there is all this new territory and new relationships to be made. And I just want to note that many of you might have had collaboration down. You might have already known exactly how to work with your partners. You might have had an entire plan, that implementation plan that you worked on yesterday with Marilyn. You might have already knocked down all the strategies for working with one another. But unfortunately, that has changed so drastically in the past year. And so this work requires new relationships or new approaches to the relationships that we already have. So we just want to encourage you to take a chance, reach out to an organization you haven't worked with before, and see what you can do together, because we definitely want to communicate, collaborate, and coordinate so we're reaching all of our people. So now you'll see this question up on the screen. We just want to hear from you. What has worked for you? Who can share a story of collaboration gone right in their organization? What is a new partnership perhaps that you have formed to reach clients during this time? I'm going to just leave that here for a second while people respond in the chat, and you're also more than welcome to unmute to share. And as we do so, I'll just lift up what Michelle said, which is that happens a lot in the Midwest. There's a fear of competition. That's really good to know. Any thoughts from people on some of those changing collaborations or new partnerships that you formed? Not everyone at once. I'm sure someone has created a partnership. Yes, no? If not, we're going to dig in a little bit here and talk about a few options that you can moving forward. Awesome. From Annie, I see we just met with a free clinic that needed some condoms. That's really great. Reinvesting in some of our medical sites is a really good option right now because those are still open. We are still considering them a essential service. A few others that come to my mind are things like supermarkets, pharmacies, working with local like shops and kiosks that are staying open. People have even, now that gyms are back open in some areas, been partnering with gym services in order to have condoms available there. I see local health department, barbershops, salons, homeless shelters, syringe access program. Oh, all of these are so great. With a motel, fantastic. Housing apartment complexes, yes, love that. Y'all hit all the other ones that I was going to bring up. Beautiful. Laundromats, that's a really awesome idea. Thank you so much, everyone, for sharing these. These are great, and I hope that others are taking some of these away as well, because it really opens some of the options for what we can do moving forward. So we're going to move on now and look at a few examples of how all of these different components, these 3Cs, play into our partnerships so that y'all can take these into consideration and hold them as we move into some activities. So we'll take first a closer look at an internal partnership example. So this is really just about how you are working with your team to ensure that a program is implemented. The context that we're looking here on the screen is that your community assessment has revealed that young men who have sex with men don't have sufficient access to condoms in certain counties in your state. And so as such, when we're thinking about communicating, coordinating, and collaborating, we offer this kind of advice for unpacking the situation. First of all, you want to communicate with other members of your program to ensure that everyone is on the same page in terms of need, in terms of plan adjustments, being aligned. This is a really great place to be using your implementation plan and sitting down with your team and saying, okay, these are our goals, this is what we've agreed on, how are we now moving forward to make sure that we address what has been revealed in our community assessment. That second piece, coordination. Coordinate with other members of the program to assign tasks and designate elements of workload. As obvious as it may seem, you want to make sure you're not all doing the same thing. You want to make sure there's no duplication of efforts, that you're sitting down and saying, okay, Carson's responsibility is to reach out to our community partners. Marilyn's is to keep track of all of the data and do evaluation on her end, understanding who holds what pieces to ensure that everything moves forward. And then that last piece, collaboration, working with other members of your department as a whole or your organization as a whole to ensure that your plans and programming are in alignment to best serve priority populations. I know that something that came up a lot yesterday was that some people are working in incredibly small teams. Sometimes you're the only person working on your condom distribution program as a singular entity. You might not have a ton of support in terms of having multiple people to designate activities to. And so in what ways can you work with the teams that are at your organization to lift some of that burden and make sure that you're reaching people? Can you collaborate with your testing team to distribute condoms? Can you talk to your syringe services programs to get condoms at their distribution sites? How can you partner with even just like your comms department and say, hey, these are the materials we need to get out and we need to communicate to our communities? Think about how you can use the resources that are already there, that are already at your fingertips to reach your communities. Can anyone just really quickly maybe plop in the chat how any of our internal partnerships have changed in light of COVID? I know that a lot of people's programs have shifted, or at least the allocation of staff has. I just wanted to confirm really quick, is that the experience people are having? Are we having people shifting away from condom distribution for COVID-19 duties? Even just a yes, no in the chat would be helpful. And thank you, as Marilyn said, for all your responses before. I can also I see our prevention staff are doing COVID-19 testing and spending less time on typical HIV prevention. Yep, we're definitely seeing that is the case. And something I'll just offer with that is, if at all possible, find ways that you can combine those things. Is there ways that at COVID testing sites you can be offering in the kits that you give out free condoms? Is there ways that you can combine those programs in what is hopefully an easy and quick and efficient way? I see not using volunteers to make kits. Absolutely. All right, thank y'all for these answers. Ooh, I also see we still have people accessing in the community while our office access has dropped a bit. We have contactless condom pickup, and we offer our own delivery service as well. We have hand sanitizer in our condom kits now. That's a really great point. Marilyn was bringing that up earlier. How can we combine all of these things? People want masks, people want hand sanitizer, they need soap. When we're giving those things out in our COVID-19 response efforts, how can we also engage condom distribution? Awesome, thank you all for that feedback. We're now going to go ahead and look at what you see on your screen, which is an external partnership example. So here we have an example of a potential partnership with another agency, which in this case is bars and restaurants. We're going to get to an example in just a minute that is a little more COVID-19 specific, because we do understand that a bar and a restaurant partnership is just not 100% what is relevant right now. But we do understand that hopefully one day in the future, this could be helpful as bars and restaurants start to open up. So in collaborating with a bar and a restaurant, for our communicate piece, we have that you need to establish whether or not a partnership would actually be helpful and furthermore mutually beneficial. So unfortunately, we can't just walk into any bar or any restaurant and say, hey, we got these condoms, can we just leave these at your bar and go? There needs to be some sort of mutual benefit or some commitment to the intervention on behalf of the restaurant. There needs to be a relationship that is built and established so that there's a sense of trust and confidence. And you want that so that they want to continue the engagement, so that they ask for more condoms, so that they encourage people who are coming into the bar and restaurant to take them, and so that you can get your evaluation numbers at the end of the day. So you can know and feel confident and secure that condoms are getting out to the community. That second piece for coordinate is coordinating with each of the bars and restaurants to align on the intended utilization of resources, a standard distribution plan, any data collection efforts, and so forth. So we want to have a plan as an organization or as a program to have a standard way of collecting our data, keeping it together, getting the same information from our different sites, so that when we are evaluating and deciding, where does it make sense to distribute more condoms, where do we need to pull back, we have all of that data and it is easy to retrieve and to analyze. That last piece on collaborating is that you need to collaborate to increase visibility of condoms and impact of the program during community events like social hours, like testing nights, and general outreach events. Think about how you are continuing to work through that site beyond that initial delivery of the condoms. Are you planning and attending a testing night at the bar? A COVID-19 specific example that I can think about is a bar back in DC that shut down for the pandemic, but continued to sell and mail merchandise to queer people in the area who were supporting their business. And that would be a great opportunity to be able to combine condom distribution with a site that you're already working with. So last but not least, we are going to plop over to this example on innovation during COVID. Thank you. And so for this last piece, we're going to talk kind of about that last situation, but how we can make some changes during COVID-19. Naturally, a lot of the bars and the restaurants that provided free condoms to community members are shut down. So what can we do to maintain and reinvigorate some of those relationships? So for the communicate piece, we just say communicate with each site to determine the quantity of condoms that remain and to discuss whether the site has brainstormed other ways to get those condoms to community. So like I just mentioned with that example with the bar in DC, it closed down temporarily, And they used to have condoms that were available right on the end of their bar and right by the dance floor and by the exit for people to be able to come and just grab condoms whenever they needed, whenever they were coming and going, whatever the case may be. And when they closed, they started creating t-shirts, cups, wristbands, all of that stuff to help them pay their own rent because they weren't able to get their income in the way that they typically would. But at the same time, from the DC government, they still had a full stock of condoms available that I'm sure was just sitting in a box somewhere. And so they could potentially be mailing those condoms out in the packages that they're already sending out to meet the need of the community that they would have been meeting in different ways when we were in person. That second piece on coordinating is to ensure that condoms are being distributed in new and purposeful ways that are most impactful considering the individual resources and access to community members that we have during the pandemic. And again, like we talked about yesterday with the example of condoms in schools, we don't want those resources to go to waste. We want to make sure that if we have large stores of condoms in some location, that they don't expire, and then we don't have to invest more money into getting rid of them in the proper way. So for instance, if a restaurant is able to stay open during COVID-19 and provide takeout or outside dining, that might be a good location to hand out condoms to customers who show up in person. If another location is entirely shut down but still has a large quantity of condoms, it might make more sense to coordinate with them and have that batch of condoms reallocated to another site where they are going to be able to reach people. Maybe even it needs to be returned to the health department so those that are still working on these programs can redistribute them through mailing systems, through doctors' offices, through some of those non-traditional partner sites that we talked about. This very last piece on collaboration is to assess and address the ways in which availability, accessibility, and acceptability, those three A's, are changing rapidly in our communities because of the impact of COVID-19. The shared goal that we have stays the same throughout this entire change that we're going through. We still need to distribute condoms to prevent the spread of HIV and other STDs. And so we have to ask ourselves how our programs and how our partnerships have been meeting that goal and what shifts need to occur to continue meeting this goal under these new circumstances. And so now on this next slide, we want to hear a little bit more from y'all. So this is going to be another option to use the annotate function. So I'm sure that our producers will plop that up on the screen right about now. Partnerships are looking really different across the country when it comes to COVID-19. We have heard of organizations that are partnering with rideshare services like Lyft and Uber, food pantries, bars, laundromats, strip clubs, drive-through services, drive-through movie theaters even, so many different options. And so what I want you to do up here on the screen is we're going to go through an activity called Stop, Maintain, Start. And what that looks like is on that left-hand box, I just want you to plop in some of the answers like who are you not able to partner with as a result of the pandemic? What adjustments have you maybe had to make to some of those partnerships, or what partnerships rather have you had to adjust because they relied mainly on in-person interaction? In that centerpiece, we're going to look at what relationships have not had to change. What have you been able to maintain? What partnerships continue to be successful and impactful? And then for start, what new partnerships have you created? What are you looking to explore? Or what do you now, after having walked through some of this information, what do you want to explore and what do you want to try? So I'll give y'all a second to plop some things in there and then I'll read some out for us. And we will also share these out afterwards so that people have these as reference. And if people are having trouble getting them in the right column or anything like that, you're also welcome to pop them in the chat and we will capture them there as well. So I see for the maintain place, we both have clinics, but we also have that falling under the stop or adjust. So I'm sure there's ways that we have had to change the ways that we interact with clinics, especially as they change to be able to face the new barriers and the new requirements that we have to keep people safe who are coming in. I see small businesses are closing, but government offices are ongoing. Social service organizations are being maintained. I see bars and schools are ones that we've had to stop and adjust. Food banks is a really great one that we've started. Awesome, awesome. Women's shelters, ones that have been maintained. Awesome. Oh, I see a few more that are slowly plopping in here. I like the ones that are coming up under start, so using free health clinics, drive-up testing sites as partners. Thank you for lifting that up. There's definitely some difficulties starting new relationships because of small county restrictions. And so we can absolutely dig deeper into that if we want to talk about kind of the ways that we can create partnerships that are low lift and that maybe meet those restrictions. Let us know and we can talk about that more. All right, some other stops. Absolutely, street outreach has been really difficult because we can't get out there and meet the community in the same way we used to. Awesome. Thank you so much for all of this, y'all. I am gonna save this and we're gonna go on ahead and move into our activity. So what we're going to do now, and let me get it up in front of me as well, is we're going to turn to page 23 in our workbook. There's space in there for us to consider what organizations you might want to partner with in your jurisdictions. And so I want you to take the conversation that we just had and take 5 to 10 minutes to brainstorm who your current partners are and in what ways you might be able to expand and foster new collaborations. Feel free to engage in the chat as we do that, but this is really just some time for y'all to look at this workbook, think about your current partners, your collaborations, and then how each of these 3 C's play a part in the work that you're doing. All right, well, thank you all for taking some time to complete these pieces. I just want to reemphasize that if you want to dig deeper on partnerships and collaboration, or you specifically want to talk about a partnership or a collaboration that you have at your organization that you either want to build, to maintain, to repair, to recover, anything like that, feel free to reach out to us and we are happy to dig into the nitty-gritty of that one-on-one in a separate space from this institute. But to wrap up, we'll just go on to the next slide and just going to emphasize one last potential like 4th C that we've added on to the 3 we covered here, and that's community engagement. So when we think about partnerships and collaborations, we want to think about more than just those businesses, more than those industries, the organizations. We also want to think about the ways in which we engage with our communities. We've talked about it a few times, and COVID has drastically changed the way that we're able to engage with people. The communities that we serve that were vulnerable before COVID are still vulnerable now. And so it's incredibly important to find ways to connect with them during the pandemic and see how our programs can continue to serve them. That can be using social media, it can be using internet surveys, but it can also be getting back out there with better PPE, with masks, with whatever safety precautions that we need to take in order to make sure that we are getting community feedback and we are hearing from the people who are being impacted by the programs that we're putting out there. We want to know through every single stage of our partnerships and collaborations that our community is bought in to what we're doing, because otherwise it's not going to have the impact that we want it to. The 3 C's, communication, coordination, and collaboration, are needed more than ever, and we kind of got to add in some of that creativity. We have to think creatively about how to provide safer sex products to our communities during a pandemic. So we ended a little bit early, which is exciting. We're going to plop up a poll on your screen for you, and we're going to move into a break for lunch. But before we do so, if anyone wants to share any final ways that they can adapt, we do have some time. Feel free to plop any of your thoughts in the chat on ways that we can get safer sex kits, condoms, lube, all of that jazz to community members during the pandemic.